everyday activities like eating, walking, showering.
Okay.
Even just taking a few minutes each day to focus on your breath can have a really calming effect.
Okay. I like the idea of finding small moments throughout the day to practice mindfulness.
Yeah.
It seems much more manageable than trying to carve out like a big chunk of time.
Right, and the benefits go beyond stress reduction.
Okay.
Studies have shown that mindfulness can also improve your sleep quality,
Wow.
boost your mood, and even help lower blood pressure.
Wow. That's impressive.
Yeah.
Okay, so we've covered healthy eating and mindfulness.
hmm
What other lifestyle interventions does the Heart Foundation recommend for managing blood pressure?
Well, as we talked about earlier, regular physical activity is crucial. Aim for at least 30 minutes of moderate intensity exercise most days of the week.
Okay.
And remember, it doesn't have to be strenuous. It could be
Right.
as simple as, brisk walking,
Right.
swimming, cycling, dancing.
Got it.
Anything that gets your heart rate up,
hmm
makes you breathe a little harder.
It's all about finding activities that you enjoy
Exactly.
and making them a part of your routine.
Yes.
And of course, we can't forget about quitting smoking.
Absolutely. Quitting smoking is one of the most impactful things you can do for your heart health, period.
Wow.
And it's never too late to quit.
Okay.
There are so many resources available to support you,
Yeah.
and the benefits are truly immense.
So to recap, healthy eating, mindfulness, regular exercise, and
Yeah.
quitting smoking.
Yes,
These are the cornerstones of a heart-healthy lifestyle.
that's right. And while these lifestyle modifications are often enough to manage blood pressure effectively,
Okay.
sometimes medication is necessary.
Okay. You mentioned medication a little bit earlier. Can you remind us about like the different types of blood pressure medications and how they work?
Absolutely. So as we mentioned, there are several classes and medications,
Okay.
each with a unique mechanism of action.
Got it.
For example, ACE inhibitors work by blocking the production of a hormone that constricts blood vessels.
Okay.
So this allows the blood vessels to relax and widen, effectively lowering blood pressure.
So they're kind of creating more space for the blood to flow through.
Exactly. Now, diuretics, often called water pills,
Yeah.
help your body eliminate excess sodium and water through urine.
Okay.
This reduces blood volume, which in turn lowers blood pressure.
So they're helping to flush out the excess?
Exactly. What about beta blockers?
Yeah. What about those?
So beta blockers work by blocking the effects of adrenaline,
Okay.
the hormone that speeds up your heart rate.
Got it.
So this slows your heart rate and reduces the force of your heart's contractions,
Okay.
leading to lower blood pressure.
So they're kind of calming things down a bit.
Exactly. And finally, we have calcium channel blockers.
Okay.
Calcium channel blockers work by preventing calcium from entering the cells of your heart and blood vessels.
Okay.
This causes the blood vessels to relax and widen, leading to lower blood pressure.
It's fascinating how all these different medications target different aspects of the cardiovascular system,
Yeah.
but they all achieve the same goal
Right.
of lowering blood pressure.
It is, and it underscores the importance of working with your doctor
Yeah.
to find the medication that's best suited to your individual needs.
Absolutely. It's about having those open and honest conversations with your healthcare provider
Yes,
to create a personalized approach.
exactly.
Okay, I want to circle back to something we talked about earlier,
Yep.
home blood pressure monitoring.
Right.
It seems like such a valuable tool
It is.
for staying on top of your heart health.
It really empowers you to become an active participant in your healthcare journey.
Okay.
It allows you to track your blood pressure trends over time.
Identify any potential triggers and share valuable data with your doctor.
It's like having a personal health detective on your wrist,
I love that analogy.
constantly gathering clues.
It really captures the essence of it. You become more aware of your body's signals and patterns,
Yeah.
which can lead to more informed decisions and ultimately better health outcomes.
Okay, let's talk about the practicalities of home monitoring.
Okay.
What should we look for when choosing a blood pressure monitor?
So the Heart Foundation recommends choosing a monitor that has been validated for accuracy.
Okay.
This means that it's been tested and proven to provide reliable readings.
Got it.
You can actually find a list of validated monitors on their website.
That's really helpful. I wouldn't want to rely on a monitor that's giving me inaccurate readings.
Right.
What about the actual process of taking my blood pressure at home?
Okay.
Any tips?
Consistency is key.
Okay.
Try to take your readings at the same time each day,
Got it.
preferably in the morning and evening.
Make sure you're sitting comfortably with your back supported
Yeah.
and your feet flat on the floor.
So it's all about creating a calm and consistent environment for those readings.
Exactly.
Okay, what about things to avoid before taking a reading?
Great question. So avoid things like caffeine, smoking,
Oh,
and exercise for at least 30 minutes before taking your blood pressure,
got it.
as these can temporarily affect your readings.
Okay, I'll keep that in mind.
Okay.
So once I have those readings, what should I be looking for?
Okay.
Like, when should I be concerned?
So as we discussed earlier, a healthy blood pressure reading is typically under 120 over 80 millimeters of mercury.
Yeah.
If your readings are consistently higher than that,
Okay.
or if you notice any sudden or dramatic changes, it's essential to consult with your doctor.
So it's not just about a single reading, but about like the overall trend over time?
Exactly. Home monitoring allows you to see those patterns
Yeah.
and identify any potential red flags early on.
And then armed with that information, we can have a more informed conversation with our doctor
Right.
who can help us interpret the data and adjust our treatment plan if necessary.
Precisely. It's a team effort.
Yeah.
And home monitoring empowers you to be an active and informed member of that team.
This has been so incredibly informative and empowering. I'm feeling much more knowledgeable about blood pressure
Good.
and motivated to make some positive changes.
That's fantastic to hear.
And we're not done yet. In part 3, we'll discuss the benefits and risks of blood pressure medications in more detail,
Okay.
and we'll explore the fascinating world of home blood pressure monitoring even further. All right, welcome back to our deep dive into blood pressure and heart health.
Okay.
We've covered so much ground already.
We have.
From understanding the basics of blood pressure to
Yes.
exploring those lifestyle changes,
Right.
and even getting a glimpse into the world of blood pressure medications.
Or-
So I think I'm ready to kind of wrap things up and make
Yeah.
sure that we have like all the key takeaways solidified.
Excellent. Let's do it.
Yeah. I think it's important to kind of circle back to those medications
Okay.
and delve a little bit deeper into their benefits and risks.
Sure.
We touched on them a little bit earlier.
Right.
But I'd love to hear a little bit more about like the specifics so we can really understand that full picture.
Absolutely. So let's start with the benefits.
Okay.
The primary reason that doctors prescribe blood pressure medications is to, well, lower blood pressure.
Okay.
And by doing so, these medications can significantly reduce your risk of serious health complications.
Like those heart attacks and strokes we keep talking about.
Exactly. High blood pressure puts a lot of strain on your heart and your blood vessels.
Right.
And over time, that strain can lead to damage and increase your risk of developing those serious conditions. So by bringing your blood pressure down to a healthy level,
Okay.
medications can help protect your cardiovascular system and reduce those risks.
So it's like they're acting as a shield,
Yeah,
protecting your heart and blood vessels from the damaging effects of high blood pressure.
I like that analogy.
Yeah.
Now, on the flip side, as with any medication, there are some potential risks and side effects to consider.
Right. I was wondering about that. Like, what are some common side effects
Sure.
that people might experience when taking blood pressure medications?
So side effects can definitely vary from person to person,
Okay.
and they also depend on the specific medication and dosage.
Okay.
Some of the more common ones, though,
Oh.
include things like dizziness,
Okay.
headaches, fatigue,
Oh.
and upset stomach.
Those sound manageable. Are there any like more serious side effects that we should be aware of?
In some cases, though, less frequently,
Okay.
certain medications can cause more serious side effects, such as allergic reactions,
Okay.
kidney problems,
Wow.
or electrolyte imbalances.
Okay, so it sounds like really open communication with your doctor is crucial.
Absolutely. It's important to keep your doctor informed about any unusual symptoms you experience so they can monitor your progress and make any necessary adjustments to your medication
Right.
or dosage.
So it's all about that teamwork.
It is.
You and your doctor working together to find the best approach for your individual needs.
Exactly. And remember, lifestyle changes are still a crucial part of the equation, even if you're on medication.
Right.
In fact, making healthy lifestyle choices can often reduce the need for medication altogether,
Really.
or at least lower the dosage that you require.
It's a reminder that we really do have a lot of agency when it comes to our health.
Yes.
Now, I want to shift back to home blood pressure monitoring for a minute.
Okay.
It seems like such a powerful tool,
It is.
but I have to admit, like, the thought of tracking my blood pressure at home feels a little bit intimidating.
I understand.
Like, where do I even start?
Well, remember when we talked about choosing a validated monitor?
Right.
That's really the first step.
Okay.
Once you have a reliable monitor,
Yeah.
the actual process of taking your blood pressure is fairly straightforward.
Okay.
The key is consistency.
Okay. Consistency is key.
Try to take your readings at the same time each day.
Got it.
ideally in the morning and evening.
Okay.
Find a quiet and comfortable spot where you can relax.
Yeah.
Make sure you're sitting with your back supported
Okay.
and your feet flat on the floor.
Mm-hmm. And remember those things we talked about avoiding before taking a reading,
Yes.
caffeine, smoking exercise? All of those can temporarily affect your numbers.
Right?
Okay, so I'm taking my readings consistently in a calm environment,
Mm-hmm.
and I'm avoiding all those things that can kind of skew the numbers.
Right.
What do I do with all that data?
Well, that's where the real magic of home monitoring comes in.
Okay.
By tracking your blood pressure over time, you start to notice patterns and trends.
Oh, yeah.
You might notice that your blood pressure tends to be higher in the morning,
Okay.
or that certain activities or even foods seem to trigger a spike. This information is so valuable because it allows you to have a much more informed conversation with your doctor.
So it's about becoming a detective.
Exactly.
Uncovering clues up about your own body and what affects your blood pressure.
And the more information you have,
Yeah.
the better equipped you and your doctor are to create a personalized treatment plan that truly works for you.
This has been such an eye-opening deep dive.
Good.
I feel like I've gained a whole new understanding of blood pressure
Excellent.
and its impact on my overall health.
I'm so glad to hear that.
So as we wrap up this episode, what is the one key takeaway for our listeners?
All right.
What do you want them to remember?
If I had to distill it down to one essential message, it would be this.
Okay.
Take control of your heart health.
I love it.
Understand your blood pressure. Know your risk factors.
Yeah.
And embrace both lifestyle modifications and medical interventions as needed.
Mm-hmm.
It's about being proactive and advocating for your own well-being.
That's beautifully said. And it's a journey, not a destination, right?
Exactly.
Like every small step that we take towards a healthier lifestyle is a step in the right direction.
It's those consistent positive choices that make all the difference over time.
So to our listener, now that you know more about blood pressure and its impact on your heart health, what one small change can you make today to support your well-being?
Yeah.
Maybe it's adding an extra serving of vegetables to your dinner.
Right.
Taking 5 minutes to practice deep breathing.
Yeah.
Or finally scheduling that appointment with your doctor. Whatever it is, take that first step.
Yes.
And remember, this is just the beginning.
It is.
We encourage you to continue exploring the resources that you've provided from the Heart Foundation and the CDC.
Okay.
We'll include links to those in the show notes, along with some additional resources that we think you might find valuable.
Great.
It's been such a pleasure diving into this topic with you. Thanks for joining me.
It was my pleasure.
And to our listener, thank you for tuning in to The Deep Dive. We'll be back soon with another fascinating topic to explore.
Great.
Until then, stay curious, stay informed, and most importantly, stay heart healthy.